Total Joint class. My name is Tammy and I teach the Total Joint classes, and I am also the mobility coach here at Missoula Bone and Joint Surgery Center. Today we're going to be reviewing this book. This is our Total Joint book. If you would like to receive a hard copy, all you have to do is contact us. Early mobilization has really changed people's recovery and outcomes. It is best to heal at home. There are certain qualifications that we're looking for you to have your surgery. One is that you have a good support system. We refer to that person as your coach. Also, we will be looking for very motivated and goal-oriented people. We will also ask you to have some labs done. Those labs will consist of some blood work, a MRSA test, which is usually just a swab on the inside of your nose, an EKG, and sometimes a urinary analysis. Our providers will look at those labs and make sure that you're in good health to have surgery. Today I will be giving you lots of information to get you very prepared for your surgery. Also, I'll walk you through the day of surgery and then what to expect after surgery. On the following page, we will talk about meeting your team. You'll have your orthopedic surgeon, who hopefully you've all met. Your physician assistant will also be working with the surgeon. The anesthesiologist, we have a group of anesthesiologists that work here for our surgeons. The registered nurse care coordinator is Krista. She will be a vital part of your team. She will be a great resource for you, and we will be talking about her a little bit later because you will also receive a phone call from her. Your preoperative and recovery room team is going to be filled with different registered nurses, and they will be helping you through those stages of your surgery. Your operating room team will consist of the surgeon. The physician assistant is always assisting the surgeon, the anesthesiologist, registered nurses, and surgical techs will be in that room. Your physical therapist mobility coach is the person who will help you to do your exercises, to get walking, doing stairs. They'll help you to get dressed and also to the bathroom. Your coach is going to be the most important. So your coach is the person who's helping you at home, making sure you're taking your pain meds appropriately, also to make sure that they're helping you with cold therapy, that you're drinking and eating. Hopefully they're being a great reminder that you're doing your exercises and you're walking according to our plan. So next is preparing your home. This is a very important checklist just to get you prepared before your surgery. The second bullet point that's listed there is consider purchasing a raised toilet seat with grab bars. So it only says consider, so think about if that is something that's necessary for your surgery. If you are having a hip replacement, if you have a precaution where you cannot bend past 90 degrees, the raised toilet seat could be very helpful. For other surgeries, a lot of times it's just going to be for comfort. So you'll just have to assess and see if that's appropriate. Other things that we want you to think about is if you are reaching or bending for lots of items throughout the day, if you could move those to a countertop surface just to make your life easier for those first few days when you're not feeling well. Also, you're going to be using a walker or crutches for the first 2 weeks, so making your home pathways a little more accessible. So if you have to move furniture, that might be helpful because you're going to be doing walking every other hour as part of your home exercise program. Also, throw rugs can be a tripping hazard, so if you can pick up those throw rugs to prevent those falls. Also, night lights can be helpful to light the path at night, just in case you need to get up to go to the bathroom. You are going to be taking some pain meds and might feel groggy. So we're just trying to help you prevent falls. So for the assistive devices, you will need a walker or crutches for the first 2 weeks after your total joint replacement. Please make sure that you bring your walker or crutches with you the morning of surgeries because we will be using those to walk and do stairs while you are here at our surgery center. When you go to your pre-op appointment, you are going to be getting a brown paper bag. Inside your brown paper bag is going to be a bottle of soap, and then you'll also have a little foil packet. This is to prevent infection. We are doing many layers for infection prevention. So inside that foil packet is going to be a sponge with a little scrub brush on one side. It also has a little pick. The pick is for use for under all of your nails. The scrub brush is also for under your nails. The sponge side is for your skin. If you are having a hip replacement, you will be washing the area thoroughly through rib cage to thigh. If you're having a knee replacement, it's thigh to calf area that you really want to focus on. If you're having a total shoulder replacement, then you want to focus on that neckline down to your arm and also in your rib cage area, making sure those areas are really cleansed. Each surgeon is going to have different requirements of when you are to use this scrub. Some surgeons want you to use the whole bottle the night before. Some surgeons would like you to use it the morning of. Other surgeons will have you do half the bottle the night before and some the morning of surgery. So 1 to 3 days before your surgery, you will be getting a phone call from our registered nurse care coordinator. So when she calls you, just beware, she will keep you on the phone for 10 to 15 minutes. She has a huge checklist of items to go through. She will be the person who will give you the most accurate time of your surgery. She will also encourage you to come in at least 2 hours before your surgery is scheduled. Different things that she will talk to you about is the type of equipment, making sure you're bringing all of your equipment with you. She'll talk to you about an overnight bag and what to pack, even if you think you're not staying overnight. She will also talk to you about your home medications. So what we want is for you to bring your home medications with you that you need to take every day. But if there are some home medications that you don't have to take every day, you can leave those at home. The home medications that you have to take every day, bring them in the original bottle with the original label. Also, if you are using CPAP, please bring that with you. If you take any type of pain medications, please keep those at home. We are not allowed to house other people's pain medications. So next you will be arriving here at Missoula Bone and Joint Surgery Center. You will be coming in 2 hours before your surgery scheduled time. When you come in our surgery center, you will come through the front door. You will check in at the front desk. At that time, you will need your insurance card and your identification. If there are any co-pays due, they would be due at that time. If you have an advance directive or any living wills, we would take a copy of that also. After that, then you will head upstairs. Our upstairs area has 3 different areas. We have a pre-op area, we have a post-op recovery area, and we have 4 surgical suites. If you want to look online at our website, you'll be able to look at those areas before you arrive here. When you first get upstairs, you'll be headed to that pre-op area. You'll be greeted by a registered nurse. They will be taking your vitals. They will put an IV in your arm. They will also give you a gown to get changed into. Before you get changed into your gown, they will be handing you 3 packages of these wipes. There are 2 washcloths in each package for a total of 6. And then there will be a color body diagram showing 6 different body areas. 1 washcloth per body area. Your coach is allowed to go up with you to that pre-op area so they can help you with the areas that you cannot reach. If they don't feel comfortable or if they're not there, our staff will help you with that also. After that, your surgeon will stop by to say hello. They will review the day with you and talk to you about what is going to be happening. So after your surgery, you will wake up in the recovery room. You will be greeted by a nurse. They will be taking your vitals. They will also be helping you to assess your pain. So please be forthcoming with them. Do not think, oh, it's not that bad, or it's a low number, I don't need to say anything. Please let them know right away how things are going so that we can keep things under control. They will also offer you a light snack and something to drink. You will be getting an x-ray in that recovery room bed also. Your surgeon will look at that x-ray to make sure everything went according to plan. After everything is going well in that post-op recovery bed, then that's when you will head downstairs to our extended recovery unit. When you get down there, your coach can meet back up with you. You will be greeted by a nurse and a CNA. They will be taking your vitals and assessing your pain. We will be assessing you the entire time you're here. After you're settled into that room, we will also be bringing a tablet to your room so that you can order some food. We will be ordering food through a food delivery system. We do not have any kitchen services here, so you will be able to choose whichever foods you like from a food delivery system, depending on what restaurants are open, what food they have available for delivery. Once your food is delivered, you've had something to eat, then that's when the mobility coach will stop by to say hello. We will review your exercises, we will get you walking, doing stairs, we will help you to get dressed into the bathroom. When you have been safe with walking, safe doing stairs, you've had something to eat and drink, you've been able to empty your bladder, your vital signs are stable, you're not nauseated, your pain is well controlled, then that's the criteria of what we're looking at, that you're eligible to be discharged home. A lot of people are leaving the same day of surgery. If you stay overnight, a family member may stay with you, and then patients are being discharged the next morning. So when you're leaving our surgery center, just a few things to think about. One is the type of vehicle that you'll be leaving in. If you have the option, if you can pick a mid-sized vehicle, that would probably be best, just because you'll be backing up to sit down. And if a vehicle is very short or very high, then that would make it a little more challenging. So that mid-sized level will make it easiest for you. One of the other things to think about is if you have more than an hour commute to go home, please stop every hour and get out and walk around. It's just really important for you to get large muscle groups moving, to move fluids around your body, especially after having surgery. Next is your nurse will give you exact written discharge instructions of exactly everything your surgeon wants you to do at home after surgery. So what to expect after surgery? So just know that those first few days after surgery are going to be the most challenging. We strongly encourage people to sleep in their beds so that you can change positions to get more comfortable. Gathering 3 pillows could be very helpful so that you can change positions with sleeping. Plus, if you have a lot of swelling, you might need to use those 3 pillows to elevate that leg. Also, we are going to expect that you are icing, elevating, doing your exercises, walking, also limiting your sitting for 30 minutes just for those first 2 weeks after surgery. So next is managing your pain. You should not expect it to be pain-free. However, we are hoping that we can help you to manage the pain and make it tolerable so that you can mobilize. We use a pain scale while you're here, showing the little faces here where it's 0 is no pain and 10 is excruciating pain. So we will be asking you to rate your pain on that scale the entire time you're here. If at all during that time that you feel foggy-headed or a little over-medicated, please let us know. Also, when you're at home, if you feel over-medicated or foggy-headed, please don't hesitate to contact us. We can try to coach you through it or maybe change that medication. So managing your pain at home. So you have a few ways of managing your pain at home. One is that you will be icing and elevating. The other is that you'll be walking and exercising. And believe it or not, the walking and exercise will help decrease your pain. When our body is in pain, it loves to guard. So our muscles will just guard and trap the pain in that area. So getting up to take a walk or doing your exercises will help decrease that pain. The other thing that you'll be receiving is some type of pain medication, sometimes a narcotic that you'll be picking up from your local pharmacy. That will help you with managing your pain at home. We highly recommend that you set an alarm for the middle of the night in case your pain medication is due, so that you are taking that pain medication. You will also be needing anywhere from 4 to 8 medications to get you through the recovery process. So when our surgeons started the surgery center, they found a pharmacy over in Bozeman called Genoa Pharmacy, and they helped them to organize the medications that you will need into what we call bubble packs. So they will describe when to take those medications, what the medication is. Some of the medications that could be in your bubble packs are going to be Tylenol, which is going to help relieve some of your pain and complement that narcotic. Second, it could have aspirin for you to take twice a day, which is going to help prevent blood clots. It might have an anti-inflammatory, such as Celebrex or Mobic. It is probably going to have a stool softener. Because you're taking a narcotic, you need that stool softener to help balance things. It might also have Prilosec. Prilosec is a stomach protectant because sometimes medications are harsh on your stomach lining. It could also have Robaxin. Robaxin is a muscle relaxer, and sometimes after having surgery, you're perceiving pain, which is actually a muscle cramping or a muscle spasm. So that Robaxin can be helpful for that pain relief. Also, gabapentin. That's a nerve pain medication. So it depends on what is ordered for you of what will be in your bubble pack. So Genoa Pharmacy will be calling you anywhere from a week to a few days before your surgery. They will discuss everything that was ordered for you. They'll discuss pricing. Their phone number is 406, and the first 3 digits are 404. So if you see that phone number, please answer your phones. If you miss their phone call, please call them back, because it's really important that we get that organized before your surgery. When you're leaving our surgery center, the nurse will be giving you a bag filled with all of your bubble packs. They will review all of the medications that were ordered for you through those bubble packs. So if you have any questions, you can ask them at that time. Also, if you are done taking your narcotic pain medications and you are just wanting to get rid of the rest that you have left, wanting them out of your house, there are plenty of drop boxes around. Here in our town, our Missoula Police Department has a drop box, and also many of the pharmacies have drop boxes. That way you can just deposit those in there and they will dispose of them for you. Also at the bottom of the page there, we have some resources listed if you have any addiction issues. So there's 2 different methods of applying cold therapy. One is through a cold therapy unit. So the unit has a cooler that you would put ice cubes and water in. It has a suctioning motor that would pull that cold water through it, through the tubes onto a pad, and it will keep circulating that cold water. That pad would be attached to that body part so that you would have that continuous cold therapy. One of the things that we found to be a helpful trick is if you would freeze 6 to 9 water bottles. Just please make sure that you're taking the labels off. The reason is why you're taking the labels off is so that when you have those 3 frozen water bottles in that cooler, that suctioning motor could accidentally pull the labels off and then burn out your motor. So 3 frozen water bottles would go in that cooler. You would add ice and water, and then it would circulate that cold water for 5 to 6 hours. If you choose not to use any type of frozen water bottles, then you'll be dumping out a little water and adding more ice about every 2 hours. So we're just hoping with those frozen water bottles that would keep things cold for you for a longer period of time to make life easier while you're struggling through those first few days of your recovery. We sell cold therapy units here at Missoula Bone and Joint. You would just have to contact our durable medical equipment department. They would be able to discuss renting or purchasing. There's also various places in town and also online that you could probably purchase a cold therapy unit. We highly recommend the cold therapy unit for people having total shoulder replacements or total knee replacements. For people who are having a total hip replacement, we sometimes recommend the ice packs or gel packs. They will be really helpful. Why we recommend the gel packs is for the hip surgery is because it will mold easier to that hip area. I always recommend purchasing at least 3 gel packs prior to surgery just because they take a long time to get cold. When you are using any of the cold therapy, you just want to make sure that you are using a cloth between your skin and that cold therapy. The things that we are trying to avoid is frostbite, so you want to make sure to check your skin occasionally to make sure there's no discoloration of your skin. We are going to give you some recommendations for cold therapy that's going to tell you 20 to 40 minutes, 3 to 5 times a day. That cold therapy is going to be extremely helpful for your recovery process. Next, we're going to talk about preventing blood clots. So knowledge is power. So you have lots of ways of preventing blood clots. One is you are going to be walking every other hour as part of your home exercise program. Next is the aspirin that could be in your bubble pack that you'll be taking twice a day. Another is when your legs wake up after surgery, if you can start doing ankle pumps, where you're just paddling your feet up and down, helping to aid circulation. The other thing that you will leave our surgery center with is a pair of compression socks. So our compression socks usually go to your knee. They have a hole in the toe area. The surgery socks will be worn for 2 to 4 weeks, and when you are in that pre-op bed, you will usually see the nurse help put that sock on. They'll place a small bag over the front part of your foot. That will ease the sock to be threaded onto your foot so it's not catching on toes or ridges of your feet. That way, when the sock is pulled all the way up, there's a hole where the toes are. That bag could be pulled out and released to make things easier for you to get those socks on. Your coach will be a great helper to put those socks on for those first few days when you're not feeling well. Signs of blood clots in your legs, just know that it could be in both of the legs, not just that surgical leg. Signs of blood clots in the legs are swelling, tenderness or pain in your calf, redness or heat. Please contact your provider right away. Our surgeons are on call 24/7. Please never hesitate to call them. If you have any signs of a pulmonary embolism, which is sudden chest pain, difficulty breathing, sweating, or confusion, go immediately to the emergency room. Do not hesitate. Caring for your incision and preventing surgical site infections. So when you leave our surgery center, everyone will be leaving with a waterproof dressing. So this is what the waterproof dressing will look like. You will wear it from 5 to 7 days. The nurse will also give you a brand new waterproof dressing when you leave here, and that will need to be addressed at that 5 to 7 days. So I said it's waterproof, which means you can shower. So just keep in mind we're wanting that dressing to be intact for the first 5 to 7 days, so just don't let the shower beat on that dressing area. No submersion, so no bathtubs, no swimming pools, no hot tubs. So when 5 to 7 days comes, and that's when it's going to be time to peel that dressing off. We always say that the coach is a great helper at this time. It's a 2-person job. You'll peel that dressing off, and then that will be the perfect time for you to take a look at your incision. If you see any staples that are popped out, or possibly any unusual drainage or discolorations, we also have some signs of infection that are listed in your book in the yellow box on that corner. And if you have any concerns, please contact us. We'll coach you through that and decide on what's the next best step to take. If you take that dressing off and you look at your incision, everything looks perfectly fine, then you're allowed to wash around that incision with soap and water. You're going to let it air dry for 30 to 45 minutes. and then it'll be time to put that dressing on. And this is where 2 people makes it really nice. These dressings fold and collapse onto each other very easily. So the backing actually comes in strips. So if you can take one strip off at a time, place it on that area, you can be smoothing it while your helper is picking that dressing up, peeling off another backing strip, and smoothing it onto that incision area. While your dressing is off of your incision, please do not touch that incision. No salves, no lotions, no creams, no ointments, nothing on that incision. So once that new dressing is on, if it's a little crooked, no worries. It's okay as long as it's covering your incision. Just a reminder, the #1 way to prevent infections is by hand washing. So please, everybody, wash your hands before helping with these dressing changes. And just some reminders, no shaving before surgery. Also, we recommend no pets in bed after surgery, all for infection prevention. The next page is bowel function. So again, this is a super important topic. When you have surgery, everything slows down in your digestive system. So we are trying to help you prevent constipation. You have a few ways of helping to prevent constipation. One is in the bubble pack, you are going to be having a stool softener. So that will help. Also, we highly recommend that you purchase something such as Miralax, so that if you purchase it before your surgery, you have it at home for after surgery. You can start taking it. What it is it's an osmotic laxative. What it will do is it will flush a bunch of water into your bowels, which will push that soft stool out. If you find that you're going too much, then just back off of it a little bit. Please do not go more than 3 days without a bowel movement. Contact us. We can help coach you through it. Next is a lot of times after you have surgery, people have a loss of appetite and they just don't feel like eating full meals. So it's super important for you to think about some healthy snacks before surgery so you can be prepared. If you don't feel like eating a full meal, at least have a snack plate near you so that you can keep nibbling on food. Eating food is super important after surgery. It's really important for your bowel circulation. It's important for your healing and for energy. Also, you're taking a lot of medication, so you need to have food in your stomach or you won't be feeling well. The next thing is drinking lots of fluids. You want to flush out all those anesthesia meds. Also, you're taking a lot of medication, so drinking a lot of fluids and staying well hydrated is going to be super important. So next we have activities of daily living. So walking, I had said that we would get you up walking while you're here. We'll teach you certain techniques so that you are safe with your walking. You'll be using a walker or crutches for the first 2 weeks after surgery, just to balance the healing of that new joint. Next is climbing stairs. We will teach you a compensating technique while you're here of up with the good and down with the bad. Taking showers, we touched a little bit on. Also, we highly recommend that you have someone at your home for the first few times that you are taking a shower. Next is riding in cars. We reviewed that slightly. Also, we recommend if the seat is back, that will give you a little extra leg room just to make things a little more comfortable getting into the car. So just another important reminder is there is a pre-op checklist. Please make sure that you are reviewing this so that you are organized and ready for your surgery. It will tell you when to stop certain things and what to do and not to do. You will be getting a call a day or a few days after your surgery. It's going to be one of our surgical nurses. They will be checking on you. They'll ask you lots of questions. They'll ask you how your pain control is. They'll ask you if you've had a bowel movement. So just know that they will be calling to do a little checkup. Also, if you have any questions at all during this entire recovery process, please do not hesitate to contact us. We have given you lots of resources, so you have lots of phone numbers to contact us. Also remember we have a surgeon on call 24/7.